Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials. Welcome to the Health Deli. I am actually not going to be the host today, but I'm going to do a little bit of introductions. So if you listened to the last episode, if you're a regular listener, we have expanded the Health Deli. We bought the shop next door. Unfortunately, Pedro's went out of business. So we're expanding the Health Deli, and we're looking to add a couple of hosts. So we're doing some interviews of a couple people. So with me today, I have Dr. Michelle Kelly to my left. How are you?
I'm good. How are you?
I'm fantastic. I thought you knew that. And to my right, I have Dr. Katie Axford. How are you?
I am well. I think it's interesting you say we're auditioning, but really you're the only one that has this responsibility. Mike and Ben, they've bugged off. They don't care.
Yeah. Mark, are you HR?
Mark?
Or just represent?
I am
You're
HR. I'm not only the meat counter. I am also HR.
Oh yeah, small business.
Yeah. I
Somebody's
clean the
gotta be on
toilets. I do all that kind of
Good.
stuff.
Do you have one of those shotgun plungers? Saw that in Marne, Michigan.
No, do you like put a shotgun shell in it?
No, it's a shotgun with a plunger on the end of it for cleaning the toilet.
Well, I'm getting one of those.
Yeah,
For
it's
sure.
That's just like
Christmas
the
present.
Yeah.
most easily accessible, straight, long, no. I don't know.
Yeah, it's
kinda
kind of like
the-
the shotgun lighters.
Kind of like the shotgun lamp in the great outdoors.
Yeah,
There you go.
yeah.
Candy. Yeah. I like it. So today though, before that, I have to give a shout out to Andrew Tingley. Of course, he's in the studio. He's like the backbone. He keeps us on track, puts all these episodes together. Thank you to him.
And he gets a vote on whether or not we get to stay.
That's true.
That's true. And if Mike gets to leave,
right. We should put it up to the listeners. We should have like a listener poll. Have
Yes.
like a throwdown.
I can do a poll on Spotify.
Oh.
Should
Maybe
we kick
someday.
Mike off and replace him with Dr. Axford?
Well, that doesn't even have to.
I don't know.
That's going to be a yes.
I would assume he's entertaining.
You could just leave it at, should we kick Mike off? Yes. The only one that would vote no would be Mike's mom.
That's true.
Well, I'm not even sure. After having her on the episode, she might actually vote to kick him off. And of course, we're in the beautiful Health Deli studios here in Big Rapids, Michigan. Much better than our old, for those regular listeners all the way back from season 1, we used to be like in the dungeon studio. Now we have this beautiful
None of those
studio.
were on video though, so they didn't really
Oh, good.
know it.
No one wanted
know
to be
where
in
you
that.
were at in your deli.
It was, we've upgraded quite a bit over 3 seasons. This is the end of season 3.
This is
kind
the
of-
last episode.
Yeah, kind of amazing, really, that they've allowed us to be on for 3 seasons. And we're coming back.
Yeah.
Coming back for season 4 with some changes.
Who gave you the extended deal?
What do you mean?
Well, how did you get season 4?
HR.
Oh, okay. HR approved that one.
Yeah, HR approved it.
Yeah, that makes sense.
So we're coming back. So, HR and marketing. Yeah, they said we were good to go. Management.
yeah.
Yeah. So,
And that's all you.
Well, yeah.
Well, who else would be in charge of
Marketing.
marketing?
Ooh, I like what you did
I
there.
haven't heard that one before.
Yeah, that's a good one. That's a dad joke. Do you have a database of those?
Wow.
Nice. All right. So today's topic, though, is really going to be presented by you all, and it's smoking and vaping. Is that right?
We're just going to talk about smoking and vaping and kind
And
of
how,
talk about,
like, it's good for you.
we're going to talk about some of the harms, and how to help people quit if they want to quit. So yeah, we'll have a conversation. I know we've done some work, Mark and I, and some other team members on this topic, and Katie and I have done some work on this too. So I think hopefully the 3 of us can put our heads together and provide some valuable insights to
So
listeners.
this is kind of a passion project for you. I mean, you know what you're talking about.
Yeah, I didn't just
That's why
Google
this
AI
topic-
it like Mark did on his last topic.
That's true. Good point.
Well, I'm not going to lie. There was a lot of
I
Googling
look
going
forward
on.
to this episode then,
Right.
instead of the last episode.
I didn't even hear what Andrew said. I probably didn't want to.
Yeah, so
So smoking,
yeah.
vaping. Give us like a little bit of background, because I feel just walking around, I don't think as many people are smoking. Is that true?
Rates have gone down. So I feel this similarly that, depending on your social circle or your workplace, that it might feel like, there's really not smoking going on anymore, but, the numbers are still prevalent. So even looking from 2021 CDC data is 11.5% of US adults are current smokers.
11.5.
Yeah. So that's over 1 out of every 10. There's definitely some hot spots. There's counties, there's states that have higher prevalences than other states. We're in Michigan. Michigan is higher than national averages. So in Michigan, we've got about 15% of U.S.
Oh, really?
Yeah.
We're above the national average.
Oh, yeah, we are. Mm-hmm.
Now, just to put it in perspective, what was like the most? Probably in the 70s or 1960s, I'm thinking. What was like the highest rate of smoking? Do you have any?
I think I think there was a time point where it was right around 50%, even higher than that.
And that makes sense. Like
yeah.
when I was a kid, it was like everybody
yeah.
smoked.
Mm-hmm.
Yeah.
And it was advertised that way. It was, when you look at some of the first ads from, or some of the first marketing that went out in, 1940s or so, is I feel like when marketing really got huge, this is the number one doctor recommended, nurse recommended. So when you're the healthcare provider recommending that, and we talked about it in the last episode of nicotine, or, the main kind of stimulant that's in tobacco products, being kind of that stimulant, just like our caffeine. So causing that kind of focus, that alertness, some of those things, before we saw some of the long-term health benefits, long-term health effects and harms, we thought, wow, this has maybe some use for people. And that we're still seeing those effects. So we're still seeing, the death rates from smoking and smoking related diseases are still the number one preventable disease, or the number one preventable death, in the United States, because we're still seeing, even if someone quit, 10, 20 years ago, they still had that years of exposure, years of maybe continued years of secondhand smoke exposure that, it's going to be a long time before we can say,
so you can't
we've
walk
gotten
back.
rid
Obviously,
of
you
this.
can't go back in time and stop smoking earlier. But it's still important to quit smoking, right? I don't want the listeners to think like, I smoked for so long, it doesn't matter now. Right?
No, there's some good, really good data that, as soon as you quit, there's almost immediate health benefits. So within 20 minutes, your heart and blood pressure decrease. So your heart rate and your blood pressure decrease, which for most patients is usually a good thing. So if you live at a high heart rate or high blood pressure, you're at increased risk of stroke and heart attack. So just that, stopping that, smoking or use of tobacco almost immediately, you have some of those quick benefits. Your circulation, lung functionality improves in just a couple weeks, and really just continues to improve the longer you can stay quit. Your risk of heart disease, heart attack is reduced at about 1 year after quitting. Your risk of pretty much every cancer that is linked to tobacco, which is most of them, is going to decrease at about 5 years. And then at 10 years of quitting, you have a risk of dying from lung cancer is 50% less likely than if you would have remained smoking.
So say that again. How many years? 10 years? 5 years?
For which one?
For the last
For the last one. So
cancer.
10 years. So if you've quit for 10 years, your risk of dying from lung cancer is 50% less likely than if you would continue.
Wow, 50%.
Yeah. So
that's impactful.
So very good benefits from quitting. And at any stage of quitting, there are those benefits. But there are still some of those risks that if you were a former smoker, it's going to still put you at higher risk of heart disease, of heart attacks, strokes. So some of that we just can't get rid of. And I think that's where I have really, taken this on and as an interest and an area of my research, is because there is that long-term benefit. And so getting people to not even start is so important. And just, it is an addictive substance that once you start, it's just incredibly difficult.
Yeah, if you talk to a smoker who smoked for a long time, they never say, boy, that was a great decision I made. Never. You never hear that. You know, they always want to quit.
Yeah.
And they can't because they are addicted.
Yeah. And we have, you know, most of the data is around, you know, 60 to 70% of smokers say they want to quit. So we know people want to quit. I think, you know, years ago, decades ago, we didn't necessarily know of the harms of smoking or as bad of the harms of smoking. Now we're pretty aware of it. I think most people that smoke are pretty aware of it, but it doesn't, you know, negate the factor that it is just an incredibly hard thing to be able to actually quit. You know, in talking with patients who have quit or have tried to quit, you know, some of them have used other substances that most, you know, they've used cocaine or they've used, you know, heroin and have said nicotine was harder to quit.
I think Mark Twain said quitting tobacco is the easiest thing he's ever done. He's done it 1,000 times. So, it's very addictive, obviously.
Yeah.
You know, I wonder, and maybe if you're going to go into this, I don't want to have a spoiler, but I think of smoking or really nicotine use as kind of like an over-the-counter mental health medication. You know what I mean? That we talk a lot about the physical, you know, side effects and how bad it is for you, but I think a lot of people turn to nicotine, you know, to maybe because they're stressed and they think it's going to decrease their anxiety, but really it really increases anxiety. I mean, it's a stimulant. So then you have this kind of self-feeding system where you're like, I'm stressed out, I'm going to use nicotine, and then I'm more stressed out, so now I need more nicotine, and then it just get into this loop where really that's not what they need.
Yeah, I think there are a lot of...
that's all they have that's available.
Yeah, there are a lot of myths out there, I think, about tobacco use, smoking, vaping, all of those things. I think that's a great one that you bring up.
Yeah, I always talk to patients about that being kind of like a roller coaster, you know, where, as soon as you take that hit of vape or smoke that cigarette, you get those very immediate effects, but you also get that very immediate just downhill crash.
Yeah.
So
we talked about smoking, 11.5% down from
nationally. In Michigan,
is that
higher
like maybe
than that.
The lowest that's right. Michigan. It's about the lowest that's ever been in recent history, right? Now, what about vaping though? The other side, kind of the other coin. Yeah.
So vaping is what has really increased. So over the last probably about 15 years is when vaping got introduced into the US, and that continues to rise. We've seen a little bit of plateau. So it continued to rise through 2019, it kind of plateaued. So we're starting to see some, you know, I guess a little bit more steady. So we've got about 8.4% of adults in Michigan use e-cigarettes, and nationally about 7.7% of adults. And you'll see different numbers from different, you know, this is between CDC and then Truth Initiative are where I usually grab a lot of these statistics. So a little bit variance because they're doing some estimations and extrapolations, but so we've seen that go up. I think the scary thing is that it is just, you know, I wasn't around when cigarettes started, but looking back at history, I know
you can remember when the first person smoked the first cigarette.
We really should have invited Mike for this because we need that historical perspective.
Yeah, one of his students. What is that thing? It's called a cigarette because it's smaller than a cigar.
It's little.
Yeah, we could have used that historical perspective, but looking at how cigarettes were introduced to the market, how they were marketed, who created them, who used them, we are just, I mean, this last 10, 15 years has just been complete deja vu. So the makers of a lot of our e-cigarettes are who made cigarettes. They got invented to try to help smoking cessation. So they were invented. I was going to say,
we talked at the beginning about how cigarettes were initially kind of marketed as healthy. And I feel like as e-cigarettes or vaping started to roll out, it was a healthy alternative to smoking until we find out that people like need double lung transplants after using e-cigarettes because of some of the substances that are
in
included.
Big Tobacco back in the 50s, they started this process called fluffing, where it's a nice little term that they invented because it sounds nice, so fluffy. But what they do is they add ammonia to the tobacco leaves, which freebases the nicotine molecule. So it makes it more bioavailable.
Sure.
And the first cigarette that was introduced in was Marlboro's.
Yeah.
And Marlboro at the time was like a obscure kind of not selling brand. So they just wanted to try it on them and it blew up.
Yeah.
Because you get more nicotine bioavailability. So you get more effect of it. Sure. And that's when cigarettes took off.
Yeah. Do you want to talk about how that relates to vaping?
Go for it.
I know.
I don't wanna steal it.
This is your favorite thing to talk about.
It is. It's so
it is.
pharmacist.
That's what I want you to talk about it.
You do?
I do.
Thanks.
I do.
It really means a lot to me.
Because I think there's a lot
Correct
of
me
people
if
that
I'm
don't
wrong, though, 'cause
understand this.
I don't have like the script in front of me. So if I get numbers wrong, please correct me.
Yeah, I don't have exact numbers on those things either. But
so kind of fast forward to vaping. Vaping was using freebase nicotine, synthetically derived nicotine. And so it was kind of an equal punch, I guess you could say, to cigarettes. And there's obvious differences between how effective the delivery system is, but you can kind of throw it up in there and say, roughly equivalent. But then Juul started making a different salt form of nicotine and introducing that. So the milligrams, so the weight of the nicotine is roughly equivalent, but it's much more bioavailable. And that's when that product took off because it's not the same nicotine. It's not, if you go all the way back to rolling up, nicotine from the field, tobacco from the field, I don't even know what it would look like, and smoking it in a pipe, like I guess the first people probably did. The amount of nicotine you're exposed to was, exponentially smaller than what you're getting in vapes that are synthetically derived and special salts to increase bioavailability. So you're just getting exposed to a lot more nicotine. It makes it more addictive, which makes it, obviously more side effects. Those kinds of things.
Yeah. So not just, that also helped with them to be able to kind of increase that nicotine for palatability. So your palatability plus your absorption.
Right, it doesn't taste as bad.
So Juul was the highest percentage. Now there's some other brands out there that have even higher percentages, but I think that brings up another point that, an education piece for our listeners is just how much nicotine is in those products. So, this was probably one of the most enlightening things when we did a study a few years ago, helping people quit vaping, is that, they said, I just have the 5%. So in our minds, we think 5%, that's like not much.
Sounds low.
That's low. But it's really 50 milligrams per ml. And so how many, milligrams of nicotine are in a cigarette?
I have no idea.
Like a milligram.
Okay.
So if you vape a milliliter, which is a tiny, tiny amount, that's almost 50 cigarettes. At least two packs of cigarettes.
Gracious.
So that's the other point is, I don't want to say kids, but I mean, that's where a lot of the population uptake in vaping has been, is young kids not realizing what's in these substances, thinking they're safe. They're all pretty negative. The younger generation, working with college students here, they're very negative on cigarettes. They think those are
socially acceptable.
They're gross. They're not socially acceptable. And then I ask them about vaping and they're like, oh yeah, I vape all the time. Or my roommate vapes. Yeah, it's totally fine. And so starting to help them realize, how much nicotine is in these products, what other substances are in these products. They're not clean nicotine. So there's other substances, some of the health concerns that have been very evident this early on. And I can only imagine, 30, 40, 50 years down the road. I mean, so far the playbook has looked just like cigarettes. And I can't imagine that we're not going to see some of these major health effects.
One of the things I think that kind of differentiate the two is this idea of lung cancer is the biggest fear with smoking, right? Bar none, lung cancer. That nobody wants lung cancer.
Nope.
So I think they think, vaping, less lung cancer, because you don't get the tar and all the other things from the combustible cigarette. But cardiovascular disease is also a huge risk with nicotine in all forms, whether you're getting a vape, chewing, whatever. And that, I think, is going to be the big thing with this generation of vapors, is they're going to have increased risks of heart attack, stroke, and cardiovascular disease because of all of that nicotine exposure. Their lung cancer rates, may be only slightly elevated. It's not good for you, obviously. Probably not as bad as cigarettes from lung cancer. But cardiovascular disease is probably going to be way worse because you have more nicotine exposure. So that's what I try to tell these people.
And nicotine is the addictive substance. It's not it's not tar. No one's coming back to cigarettes for the tar. It's the nicotine. And so that's still why people are using vapes and wanting to continue to use vapes. So I think we covered some of those main side effects. Maybe we'll touch back on them when we talk about maybe benefits of quitting any of these substances. But I want to turn over to Mark for his Healthy Minute.
Well, let's pause for the Healthy Minute, brought to you by the winery at Young Farms. Today's Healthy Minute is get your flu shot. The flu vaccine is a powerful tool in protecting yourself and those around you from the influenza virus. It reduces the risk of contracting the flu. But if you do get the flu, the vaccine also reduces the rate of hospitalization and severe complications, particularly for vulnerable groups such as young children, the elderly, and individuals with chronic health conditions. Getting vaccinated not only protects your health, but also prevents the spread of the virus within the community. This is especially important in safeguarding those who cannot get vaccinated due to medical reasons. Flu vaccines are updated annually to match the most current strains of the virus, making it essential to get vaccinated each year. The vaccine is widely available at doctors' offices, pharmacies, and health department clinics, often at little or no cost. Make your health a priority and get your flu vaccine this fall. It's a simple and effective way to contribute to a healthier community and protect yourself during flu season. That was the Healthy Minute, brought to you by the winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Boom, chicka, boom, healthy.
I love that you get that, radio voice for that advertisement. It's almost like it was recorded separately, but you're just still right here.
Oh, I'm just right in your ear all the time.
Yeah. So let's pick back up, talking about some of the harms of smoking and vaping. I think we're just still kind of in this unknown period. There was a point in time when even CDC had put vaping as safe, quickly turned to safer, and especially out of context. You see that or people see that and think, oh, okay, this is cool. This is a way for me to get my nicotine and get my
not have any bad effects, right?
Yeah. So I know Katie touched on, we have had some lung transplants happening from vape users, and I think that's where too it is a little different than cigarettes, because we've never had some of these very serious immediate consequences from smoking.
Popcorn lung.
Yeah,
right?
But vaping, we had popcorn lung, we had EVALI, it caused thousands of deaths, and tons of hospitalizations, ICU stays, lung transplants.
Right.
And we don't see that in cigarettes. Someone can smoke for a year.
It's a long game, right?
Yeah.
And I think a lot of that goes back to the products and how they're compounded and how they're made, because it's like they were just throwing whatever in there. We went to a vape shop as part of our research.
We did.
And it was eye-opening to see kind of what they were doing and really their lack of knowledge about how to make these products and make them safe for inhalation, right? When we're making inhalation products in a hospital setting, we're using a full-on clean room. We're double-checking all of our math. And this was more like, making a cookie or something like that, where it was like, hey, we'll put a little of this in there, we'll put a little of that in there and see how it turns out, which can be incredibly dangerous.
And a lot of the, some of the health effects are really just from those flavoring agents that are maybe not that unique, but those compounds can interact, when put together. So when they're making strawberry shortcake,
and it's, to me, it's like appalling that it took so long to get any kind of regulation.
Oh, I know.
And it still isn't regulated to the extent that it should be, in my opinion, but Like when you step back and look at that, like they're making vape solution that's strawberry shortcake. Like you're not going after a 40-year-old smoker for cessation who's going to buy strawberry shortcake flavored vape. Yeah, that's obviously going after children.
Right.
There's no other way to sugarcoat that, pun intended. So it's just ridiculous that was allowed.
Yeah,
it's crazy.
It's like the McDonald's of cigarettes.
yeah,
You're right. Nothing against McDonald's though.
yeah.
I watched Super Size Me again recently.
Yeah.
So it's, it's still a problem. I mean,
And they're
It
businesses.
is.
They're businesses, and they do their target audience and
Exactly.
marketing analysis, and they figure out
Yeah.
how to get those things bought. So
when I'm sitting at the gas station, that's really the only time I see these commercials for Juul and some of these other vaping things.
Oh,
And
yeah. It's on the little screen.
Yeah, they just look so cool. I mean, that's all they're trying to do.
Yeah. Think back to the 1940s when you had like the Clark Gable smoking a cigarette in a magazine. All
Right.
look cool.
Yeah, I didn't see Clark Gable on the screen, but whatever.
I thought Andrew was up there.
They were more like beautiful people, and they were like young people, and they were like different lifestyle things. It must be the flavors and the different kinds that you can get, because they were trying to represent it with people dressed in the same person but dressed in different ways.
yeah, and even just the different devices can be different things. I've seen their like little cupcakes.
Really?
They look like USBs. They look like, they're just very hidden. And so I feel for, the elementary, middle school, high school teachers that really got bombarded with this, probably 5-6 years ago. I mean, it just took over and disguised, and it's constantly changing to try to stay up on what's happening.
So we could have a Health Deli branded vape.
I think that would be awful idea. That's the worst idea you've ever had.
That's taking us
HR
back to
has
when.
stepped in.
Right. We are not. I'm the marketing department, and we're not doing that.
Okay, good.
But we do have coffee mugs, so we're still okay with caffeine.
Okay, good.
but that's about it.
Yeah, but in moderation.
Only in moderation.
In
200
moderation,
milligrams
even.
or less per day.
Right, not 5 gallons in 1 hour or whatever.
Yeah, so let's talk about. So we are all pharmacists, and so
Except me.
sorry, except Andrew.
That's okay. I can ask the stupid question.
Okay, that'd be great if you could ask us some questions. We're going to talk about some of the guidelines and even medications to help people quit and resources. I think we did give some very doom and gloom at the beginning of how many people are using these products, and then also how many people want to quit. I didn't share the number of how many people are actually successful quitting. That number is much lower than that 70% who want to. But that number is lower because a lot of people try to do this on their own. So most patients try to do cold turkey. They try to do it without any sort of support or health providers or anything like that involved. So when you put the pieces in place, the rates of quitting significantly increase. So we can get to probably 30, even almost 50% when we use the right meds and we have the right support systems in place. So first of all, so CDC, Centers of Disease Control, is where we get a lot of our guidelines. Unfortunately, in the US, those guidelines have not been updated since 2008.
So was vaping even a thing in 2008?
No.
Okay, I was going to say.
So
Just trying to think what I was doing in 2008.
there's a little, there's some puzzle pieces missing from the puzzle there.
Sure.
And so it only covers traditional cigarettes. It doesn't even cover cigars or smokeless tobacco, chew. And those have been around for much longer, but they are always have been used in a smaller population.
Yep.
So all of our guidelines, all of our FDA, so our approved medications are all approved for traditional cigarettes. So our combustible cigarettes. So that's kind of, I think, my big challenge as a healthcare provider is not necessarily having great guidelines and great medications that are approved for what I want to use them for.
Though, but is there some crosswalk where people are kind of making the assumption that these would also work for vapes?
Yeah.
Okay.
In very small research trials. So it's hard to get a new indication onto an FDA approved medication. So you definitely run into some IRB issues. And then also from manufacturer standpoint, there's not necessarily a lot of money in it.
Right.
So it takes a lot of money to get a medication approved or add an indication. So no one's gone through and done this. You know, Pfizer makes Chantix, but now Chantix is generic.
Right.
I mean, I think it would probably open up that if they would have done it a little bit sooner, they maybe could have extended their brand exclusive.
You know, I wonder, and this is just me thinking outside the box, I hope a drug manufacturer, if any are listening out there, can see that these people who are vaping right now will eventually want to quit. Maybe they're not there yet.
No,
but in
they
the next
do.
5-10 years, there's going to be a huge amount of vapors who want to quit. And maybe the research is going to show maybe that it needs a little more of this med or a little more of that med or a combination of meds that could be patentable. And they could market that just for vaping, you know, for that higher nicotine exposure. I don't know.
Yeah. So that's what I think people are looking at right now of, you know, how do we help people quit? So CDC put together some resources, you know, based on kind of some very generic, but they didn't say using medications. It was behavioral, you know, making sure, so it was more for EVALI, but making sure they're healthy. So getting their flu vaccine, making sure they're up to date on vaccines. If they actually have that lung condition, how do we Band-Aid that basically? So World Health Organization, I think that's how maybe I got on this show today, was that World Health Organization put out the first ever guidelines from them on quitting tobacco. So it took till 2024. Wow. We've got over 1 billion tobacco users in the world. Before the World Health Organization puts out some guidelines.
Interesting.
So good thing about the guidelines, it does cover all forms of tobacco. Do you know what the downside is?
Not vaping.
Correct. It says e-cigarettes are beyond the scope of these guidelines because the potential benefits and harms of using these products are complex and are addressed in a separate body of literature. I don't know if you guys have ever looked at the body of literature.
I haven't.
It's not much. Body. It's a small body. The body that uses the most, I guess we'll say, medications to help with the treatment is still Dr. Kelsch's and mine research from 2018, 2019, published in 2020. And since then, no one, you know, the other ones out there are just case studies. So a case study for using varenicline, a case study for using NRT, which is our case study.
Right.
And that's what I saw, like, Australia put together guidelines and they cite just they're making these recommendations off case studies and our pilot study to help with some of these things, which is not at all how you get FDA approved medications or a new indication. So most guidelines are just saying behavioral support for people that use vapes. So that's it's a piece of it. So there is definitely a behavioral component of vaping, but it's still a highly addictive substance. And when our users our vape users are getting even higher amounts and concentrations and the spike. So looking at the bioavailability. So there is some literature out there looking at bioavailability, and it masks pretty much how quick it increases and reaches someone's brain and then dips. So it like mimics cigarettes, but even gets a little bit higher than cigarettes. So
I can see that. And the convenience factor.
Yeah.
So, I mean, cigarettes, you have to kind of commit to it, right? You got to walk outside. You got to commit 5-10 minutes, whatever it takes. Whereas vapes, man, you're constantly hitting those vapes, exposing more and more and more nicotine, reinforcing that addictive behavior. So really it's worse. I can't believe the World Health Organization, you know, when we were at 50% smoking, you know, in the United States was pretty much mute on the issue. And now that we've decreased down to probably our lowest point maybe ever, now they're like, oh yeah, now we got guidelines, but not for vaping, which is taking off.
Right. Yeah. So the World Health Organization recommends behavioral counseling, and medications to help people quit using tobacco. So, I got really excited when this hit my inbox that World Health Organization put out some guidelines, updated. I was excited. I read them. I was a little not so excited once I read them. They're very similar to what we've already got. I guess the nice thing is that they include other forms of tobacco, but we're still operating, in the U.S. and really, trying to stay on label with FDA approved medications, and we still don't have that benefit. The one big difference in the World Health Organization is cytosine is used in other countries. It's not FDA approved. It's not used in the US, but that is another medication that is used worldwide to help people quit smoking. So in the US, FDA approved medications, and this is what CDC and also the World Health Organization recommend, is varenicline or Chantix, which is our newest medication. It works by blocking the nicotine from the nicotine receptors. So I do think that probably has the easiest way to prescribe it because you don't have as much dosing calculations and concerns with giving someone varenicline that vapes. So you don't have to really take in how much, tobacco, how much cigarettes, how much vaping they're using to be able to prescribe or help them use varenicline. So I think that's a great option. It does have some of the best outcomes. So, those that use it have the most success in quitting. Nicotine replacement therapy are also available. So, over the counter. So without a prescription, you can get
like patches, gum.
Yep. You can get the patches, gum, lozenges. So those are pretty commonly available. So, always talk to your pharmacist if you need help in picking those out.
There used to be an inhaled nicotine. Is that even available
there's
still?
still Nicotrol inhaler.
Okay.
Mm-hmm.
All right.
They did take off the nasal spray. So the nicotine nasal spray is no longer available.
Okay.
Yeah.
I haven't seen that in a number of years, but.
I think one of the tricky things, though, right, like you were talking about with the nicotine replacement products, is that because the amount of nicotine that vape users are getting is so much higher, we dose those products based on how many cigarettes someone is smoking. But if someone is getting so much more nicotine, what's the right dose to actually be effective?
Yeah, I wouldn't even know the question to ask. Like, because cigarettes are very, quantifiable.
Mm-hmm.
I smoked 18 cigarettes yesterday. Vape is like, how much do you vape? I wouldn't even, because the cartridges aren't the same size.
So so we started by asking what type of device do they use. They usually didn't know what the chamber held, and it depended to the pods. So if they used a pod or they used a chamber, so we'd have to look up. Usually we had to look up what that held to get a milliliter. Then we'd ask them what percent they were using. Sure. Sometimes they knew, sometimes they didn't even know what percent they were using. Then calculated a milligram of nicotine from there. Then we'd have to ask them, how often do you refill or change your pod? Because, if it was 2 weeks, that's different than a day or two in their nicotine amount they're getting. We started our framework off of our smoking cessation framework and how we asked some of these questions and trying to figure out how addicted they were. So we still had some people that, really more just used it socially, that it was when they were drinking or out at bars or hanging out with friends, they were sharing someone else's vape. But then we had some that were doing it all the time and didn't even realize how often they were doing it. So we started with just having them start by tracking their use. And I think that was eye-opening to the person to actually see how much they were using it, because they realized they were just subconsciously using it almost continuously.
That's a good message to listeners that maybe, want to quit vaping or know someone who wants to quit vaping is, it's hard to walk into a place and buy the nicotine replacement products because you don't know. There's no recommendations for vaping.
No. Right.
So you need to talk to that pharmacist because they can kind of help guide you through that, do some math and figure out, what your exposure really is.
Yeah. And then the last one out there is bupropion. So that is used for anxiety, depression, but we saw a benefit in those patients that were getting treated for some of those other conditions, that they actually decreased their rate of smoking when using those. So that's another one that isn't really dose dependent on nicotine to prescribe. But I haven't seen even a case study using bupropion with someone that vapes, but we have good data for smoking cessation. So where most of the resources and literature resides in helping patients who vape quit doing that is really through behavioral counseling. So through some of our text services, our apps, a lot of these patients are,
numbers, quit lines, and helplines.
Yeah. So that the quit line is a national quit line. It comes in numerous languages. You can get services in numerous languages. You can even start texting that number as well. And then there is a quit start app as well. So that number is 1-800-QUIT-NOW. If you need that actual number, it's 1-800-784-8669. And then another group is This Is Quitting, and you can text ditch vape to 88709, and that will start a conversation helping people quit using. So learning more about them, sending, some motivation text, how to help find your triggers, help to find other habits that can be better, and any individual or group counseling by a trained professional like a pharmacist or your healthcare provider. Any of those things are going to increase someone's increase their success rates of quitting. So
that's great.
That's my take. I guess I'll give it your takeaway to our listeners of, if you use any of these products, or know of someone that uses any of these products, talk to your healthcare provider the next time you're in and start exploring some of these options. And even if you don't decide now, start to think about it. And, when you're ready, there are tools to help you quit.
Yeah, I like that message. One thing we're not going to do at the Health Deli is sell vapes or cigarettes.
Yep.
We don't sell those here. We're expanding, but we're still only carrying our healthy products.
Yep.
So I think that does it for our episode for today. Great episode. Again, this is the end of season 3. So look for some changes in season 4. We're going to have a little bit of a new look. We're going to have a little bit of a new feel. We're going to try out some new things. So until next time, we're going to hang up the sign, end this interview. And you guys might be getting letters from HR. Maybe you're not going to get letters from HR. We'll see.
Well, thanks for having me.
So check back on season 4. See yous here at the Health Deli. Until then, signing off.
Adios.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.